Vitamin K is a nutrient that you may see included in bone health supplements, but not really know why it's in there. And that's a fair point because it's not a hugely popular nutrient, and with bones, most of us usually do think of calcium and vitamin D as the big players because they are. But vitamin K, it plays a pretty big role with bone health, and that's what we'll be going through today. I'll let you know what vitamin K does for your bones, the difference between the two main forms of vitamin K, and what the research says, so that by the end of this video, you'll be able to make a decision about whether it's something you need to consider. So, let's go. So what role does vitamin K actually play for bone health? Well, it's not directly involved in building the bones themselves. What vitamin K does instead is it activates certain proteins that make bone mineralization possible. But what in the world does that actually mean? Well, within your bones, there are proteins called osteocalcin, and this is made by cells called osteoblasts. Now, osteoblasts are the cells in your bones that are essentially responsible for building up your bone. Osteocalcin, when this is in its inactive form, which means it's turned off, it can't hold on to calcium, which is a problem because calcium can't just be floating around in your bones. It actually needs to be locked into the structure by our friend osteocalcin here. So vitamin K, it comes along, it binds to osteocalcin, it essentially turns it on, it activates it, and then osteocalcin can now bind to calcium. And that's good because by binding to calcium, it means calcium is locked into the bone structure, and this is what helps to keep bones quite strong. It's that network of minerals interconnected together. Even if you did have enough calcium coming into your body through your diet, if you lacked vitamin K, then your bones wouldn't be able to fully utilize that calcium within your bones. So that's how vitamin K helps with osteocalcin, but there is another protein that it helps with too, and this one is called matrix GLA protein, also known as MGP. Now this is a pretty important protein because it helps prevent calcium from building up in places that it shouldn't, so particularly in your arteries. Vitamin K comes along, it activates this protein too, so once again it's making sure that calcium is where it needs to be, which is mainly in your bones. So if you aren't getting enough vitamin K, then these two proteins won't be able to do their jobs, and that means calcium will be used less efficiently. Your bones won't be as strong, and calcium might end up in places it shouldn't be, like your arteries. And this is why you will likely be seeing vitamin K being included in lots of bone health supplements, because of these two proteins and what it does for them. Now there's two main types of vitamin K out there, vitamin K1 and vitamin K2. So vitamin K1 is called phylloquinone. This is the version that is found in leafy greens like spinach, kale, also in broccoli. This form of vitamin K is mostly linked to blood clotting, which used to be what vitamin K was most known for, and I will be having to talk about this later on when it comes to safety. Now vitamin K2 is called menaquinone, and this comes from fermented foods and also some animal products like egg yolks or liver. Your gut bacteria also makes small amounts of this version too. It is this vitamin K2 form that has been studied for bone health and also for cardiovascular health. And to make things more complicated, vitamin K2 has subtypes as well. The two that you will most likely see in supplements are MK4 and MK7. Now MK7, it tends to stay in your blood a bit longer, and so you don't need to take it as often. And MK7 comes from bacterial fermentation. Fermented soybean is actually the best dietary source of MK7, but it isn't exactly hugely popular in Western diets. According to our Australian dietary guidelines, women need about 60 micrograms a day of vitamin K, while men need 70 micrograms per day. So what does the research actually say? Well, the most evidence seems to be behind using vitamin K in women who have gone through menopause. This is likely because this is a higher risk group for low mineral density. After menopause, the drop in estrogen, it really reduces the bone mineral density in women, and fracture risk goes up for this group in particular. So existing studies, they've found that using vitamin K in this group of patients has resulted in the maintenance of bone mineral density within postmenopausal women, especially when it's used in combination with calcium and vitamin D supplementation. but it didn't significantly reduce their risk of fracture. Now, when it comes to doses, this is actually a bit all over the place. So the studies at the moment, they have used higher doses of the MK4 version, and this is about 45 milligrams a day, which is really high compared to your daily intake requirement. And we'll talk about why this is so high in a second. But if you look at the MK7, you'll find that they use much less of that, about 180 to 375 micrograms per day, which sounds more in line with what I'm used to seeing. So if you are looking into supplements, I would pay much more attention to the MK7, because the MK4 that is being used in existing studies, these are all based in Japan, and the version of MK4 that they're using is actually much higher because it is a treatment dose for osteoporosis. So it's almost like a pharmacological drug, and it is prescribed as a treatment, and it is a much higher dose than what someone simply looking to look after their bones or maintain bone density would need. So it's the MK7 that you would need to look for instead. Now, the important thing to note is that this is not something that everyone can just safely take. For anyone on blood thinner medications, specifically warfarin, do not start trying to increase your vitamin K intake without speaking to your doctor. Vitamin K, it changes how warfarin works, and if you increase your vitamin K intake while on warfarin without adjusting anything, you can increase your risk of getting a blood clot. So anyone on blood thinners or having blood clot issues, talk to your doctor before doing anything. But that is probably the most dangerous and risky thing about vitamin K. It's if you are taking warfarin as a medication, which tends to be more popular and more commonly used in older adults, potentially over 65. Just bear that in mind. Now, as always, my first suggestion will always be to look at your diet first and see what you can do to increase intake that way. Vitamin K2, like I said, is found in fermented foods and also egg yolks and liver. Granted, these aren't exactly popular food choices for a lot of people, but if you are someone who is willing to give those a go, that would be the best way to go first. Now, if you are someone with low bone mineral density, then it does seem that a supplement with vitamin K2 can help. When you are looking at supplements out and about, I would suggest just looking at the labels and making sure that it has the MK7 form in a dose of about 180 micrograms, because that has the most evidence behind it for helping with your bones. And remember that vitamin K is just one part of bone health. The research shows it works best when it's used with calcium and vitamin D, and beyond that, regular resistance training and protein are also very important for bone health. The key point is only take supplements you actually need and make sure they are safe for you and your personal situation. But that is all I have to say on this for now. Hopefully you've learned something, and if you have any questions, as usual, leave a comment. But I'll see you in the next video, and until then, keep playing the long game.